So how do we manage hypersomnia? There are a lot of non-pharmacotherapeutic recommendations. Sleep hygiene, it's always the answer, right? It helps. For most people, that's not going to be, a pure treatment for it unless it's, the daytime sleepiness is due to poor nighttime sleep. With narcolepsy, particularly narcolepsy type 1, regularly scheduled naps, and they don't have to be long. 30 minutes is perfectly great. It's more of a timer between naps that seems to be the important part, not the duration of the nap itself. Scheduling regular sleep, so important. And then accommodations for sleepiness. So being able to take naps during the day, even during a work week, being able to get up and move to kind of re-energize the brain a little bit during times of sitting quietly, right? People are more likely to be sleepy when they are inactive. And then, of course, we have our medication recommendations, which stimulants is really going to be the big piece, right? So stimulating medications are really important in the maintenance of quality of life in hypersomnia. So specifically, we have things like modafinil or Provigil. We also have some newer products called like pitolisant and solriamfetol. Then we have something that's really interesting, oxybate salts. And oxybate salts work by increasing the quality of sleep at night, which seems to improve wakefulness during the day for people who have narcolepsy as well as idiopathic hypersomnia. Now, our modafinil, which is a similar product to modafinil, as well as some of our ADHD stimulants like dextroamphetamines and methylphenidates, can sometimes be used as well. They're going to be less specific to just wakefulness promoting, at least the dextroamphetamine and methylphenidates are. This way modafinil is preferred because it is more specific to being awake versus some of the other effects that stimulants have. Other weird things that you see with idiopathic hypersomnia, clarithromycin, which is an antibiotic, but it's not very commonly used. Really, modafinil is the first place a lot of people who are diagnosed get started on, and then kind of moving from there, with stimulants being our mainstay, right? So when it comes to our stimulants, important things to take into consideration, they should be taken early in the day. There's a risk of increased or decreased, I should say, effectiveness of contraceptives and potential congenital abnormalities from exposure. So people who have the potential of becoming pregnant should be aware of that. But it does improve excessive daytime sleepiness, EDS, severity of symptoms, and quality of life. And I'm someone who can attest to that personally. I was fortunate enough that the first line product worked really well for me, and I can live a much better life than I had previously, which is wonderful. Other stimulants like amphetamines and methylphenidate are usually good for between 3 and 10 hours, depending on the product. They have a higher risk of abuse and misuse, and they have less high quality evidence to support their use, so they aren't typically used first. Now, these products, Sunosi or solriamfetol and Wakix or pitolisant are actually kind of interesting. So these are approved for excessive daytime sleepiness. Solriamfetol is a norepinephrine and dopamine reuptake inhibitor. So we have another product called bupropion or Wellbutrin that also works kind of this way, but that's specifically approved for depression and smoking cessation. This one is specifically approved for excessive daytime sleepiness. Same kind of idea. You want to make sure you have a full day of wakefulness. It can increase things like blood pressure. If someone has CVD or cardiovascular disease risk, we got to be careful there. It can cause some feelings of anxiety because it's a very stimulating medication, and there is some potential for abuse and dependence. Then we have Wakix, which is super interesting because it's an inverse agonist, which we don't see very often at all from a pharmacology perspective. And an inverse agonist actually is typically going to induce an opposing effect. So, and that kind of makes sense, I guess, right? Because an antihistamine is sleepy producing. It's kind of a weird mechanism, but it modulates histamine. Okay, so it's a histamine modulator, essentially, you could say. It also can affect things like oral contraceptives. It might have some psychiatric side effects and is otherwise pretty well tolerated. Don't worry too much about like the liver impairment. That's more of an FYI piece, but it does tend to take a bit more time to work. So up to 8 weeks to really work, where most of the stimulants work pretty fast and should be taken when you wake up. And then this other interesting one. So oxybate salts, which include Xyrem, Xywav, and Lumryz. These products are going to help people sleep better. So they produce basically like your stage 3, your deep sleep, and are taken at bedtime. So if we have deeper sleep during the day, we feel more awake. If we deeper sleep at night, we feel more awake during the day, right? So this works pretty fast. It is only produced, or I should say, only dispensed through one singular pharmacy. The unsalted version, so not sodium oxybate, but just like the oxybate part, if you will, is an illegal substance, a Schedule 1, like you cannot get it. It was used illicitly to basically knock people unconscious, to do terrible things to them. But this form is a scheduled substance that has a medically approved indication, and it's not quite the same in that sense. Okay. There are some that have higher sodium versus lower sodium. So if someone needs to cut back sodium for whatever reason, we would typically go with the lower sodium version, and it is suspended in water and consumed. Some of the products require multiple dosing during the night, and really knocks people into a deep sleep, which can be quite beneficial for people who have hypersomnia, interestingly enough. Okay, awesome.